and thank you to all. I think a lot has been spoken, and good anecdotes has been shared by my previous speaker. So it makes my job very simpler. I am falling in between you leaving and having a panel discussion. So I'm the last edge of the speaking session. My basic my topic is, can we afford to ignore mHealth or eHealth the way it is? Honestly speaking, I've been using mobile over a decade back only, and the last 5 years I've been into serious mobile usage, and over the last couple of years I have taken a smartphone, and presently probably having a incubating organization developing mobile applications. After listening to all of you and previously been working in this arena, what I have been understanding that there are various jargons which are flowing across, that is telemedicine, mHealth, eHealth. We really need to understand basically what is the best definitions, how they can be described. I'm not giving them because of a scarcity of the time. But the basic thing what has been spoken last over 2 days has been affordability, accessibility and availability. How far it has reached and what is the solutions, what solutions which can further make it possible. See, one thing in the healthcare we don't need to forget that it is a serious business. It is not something where we have information available and we say that it is not making a sense, or it is really making a sense and we are doubting on that. So there is an immense need of trust, accuracy in the system and a relevance. See, I may not be needing that information. It is too much of information is there. I may not be needing that information. I may be needing only the relevant information. How to reach unreachable? This is a very prominent question. It is always there in everybody's mind. And there is a digital divide. We should understand that no doubt there is an urban and rural population. And we say that in urban the mobile communication is very popular. One can use a mobile. But we have a tier 1, tier 2 cities. And within the urban areas also, we have a population which is, or we have our friends with whom we are living. We communicate with them on the mobile phones, but there is another non-tech savvy people. I am talking non-tech savvy people because I want to include not only the persons, those who do not carry the mobile along with them. Today I find a rickshaw puller is carrying 2 or 3 mobiles just for developing a redundancy, but he is not a tech savvy. How he can read a SMS, I still do not know, because he is not illiterate. There is another class of people, those for whom we were talking about the insurance problems. They are the old people, and back of our mind, what is most needed? The thought is there: how will they be managing our lives? They are not tech savvy, so there is a need where we have to think where these mobile devices or mobility can help us to get connected to them, or the people, those who are not tech savvy, they can get connected. Again, in the rural, the same kind of thing applies. If I go to the rural villages, I had the opportunity because the mobile application company which I am incubating, incidentally it is mainly to do with the rural mobile applications. I went to the villages, I gave a mobile to a person. I said, can you operate it? He said, yes. Can you bring out the songs from this? He said, yes, I can do that. I said, you do not know how to the counting of the numbers, but how can you use the mobile? He says, sir, I got used to it. So this is a kind of a power of a mobile where no formal training has been given, but still the person has become used to taking the songs out of it, and out of 250 songs, and he could take out the Amitabh Bachchan song, which I asked from him. I'm giving some thoughts which I think will culminate into a kind of a good food for thought when you go back home or when we have a panel of discussions. Online or mHealth application, we need to search in for a good definitions, and when we are talking about the platform, there are too many platforms. Something is there. There are too many platforms. Now the question is, we are talking about smartphones, we are talking about iPhones, we are talking about Androids and Symbians and whatnot. But do you think these smartphones, from where we are anticipating a mobile applications to get developed on, will they be used by the masses, the kind of 90% of the population or non-tech savvy people? Will they be in a position comfortable in handling those devices? That is a good question. Now, the model which has to work in India has to mix and match and meet the needs. Now, we need to understand the very good thing which has come up, the infrastructure, the 2G, 3G or LTE is going to become available. But the real question is, when we are talking about the good application, image transfer, what is the bandwidth and the transfer rate which is there? Have you ever tried and understood a particular image which is to travel over the DICOM protocol and or kind of a PAX client interaction system? How much time will it take to get uploaded onto a normal mobile and with a normal transfer rate which is available to you? I am using a 3G. I take time to read even my mails when I am talking about these transfer rates. Population reach, languages spoken in India, we are not talking about Hindi, English, but there are a lot of native languages, and it is beyond 22 languages in which it goes. If you talk about Bengal or down in the south, in particular state, there are various native languages which are spoken. The budget, what is the affordability rate? No doubt 2012 is being positioned where tablets to come down rock bottom prices, provided the 2G, 3G crisis get over. But what is the budget which we are normally seeing? Is it the budget which is affordable by the masses to reach, or some kind of intervention which is necessary, where we say that some kind of funding is coming up? Now, literacy rate, this is a very big question which I have already touched upon. Access to internet using mobile, there is a good penetration. Usage of social media, how much it is being used or can be used, this is still a question. Now, no doubt we have heard about the applications like Facebook, Twitter and Skype, where most of the interactions are happening, and some of the form of healthcare discussions areas are also emanating. There are chats and discussions, etc. And there are a lot of online portals which are available. What is basically we were talking about in the morning when we were talking about 108 number, that is a sense, reach and care. I basically changed it to access, reach and care. And we have to change from the reactive model to proactive. Now, 108 is a reactive model, but can we have a reach and care, the part which probably I think you were mentioning about? Can we be proactive about it? Can we reduce a downturn? Reducing a turnaround time is also becoming a proactive. So can we do it, and can we use this technology, and how we can do it? This is something food for thought. The very interesting thing, because I'm a guest of Dr. Sanjeev, and is having a past interaction, I've been getting a lot of knowledge from him. One good thing which has come out, and we were discussing the business model. Now, suppose we are talking about mobile health, e-health. Now, and the Joint Secretary of the State also mentioned, do you have a concrete business model? And that is what we generally talk in the business consulting firms, that everything starts with the business case. Now, there is a business case, of course, but who will fund it? Now, we need to understand who are the key players. Now, there is a government, state agencies, they have been normally talking about, or we are making them to talk. There is a NGO global agencies. Now, the biggest fund which is available in any vertical is with the healthcare. Are you aware of it? That is the largest fund. See, if I talk about the telecom, BFSI and retail, whatever kind of money which they are talking in the captive funds, but the largest fund which is lying is with the healthcare, and that is where most of the companies nowadays, they are focusing upon it, and they are trying to resonate something or the other. That is the basic premise. But beyond this, there is a whole need which we need to understand, realize, because there is a problem area. healthcare provider, hospitals. Now, I am not forgetting by mentioning the healthcare providers because it's a lot of professionals which are associated over there. Insurance agencies, they have health plans to sell. Telecom is a service provider because the usage will start increasing, so they will try to do something or the other in that arena. They will try to help you with some kind of fund. If you are aware that mobile value-added services, the model, the SMSs which you get or value-added services, for example, hangama.com, you are able to download a song at a price. Now, basically, if you see the background of it, 30% goes to the application developer or probably the sound, the person who is uploading the sound or who is developing the application, and 70% goes to the service provider. If that kind of a model can be developed, service providers like logistics players, pharma, retail, because they also downplay a lot of things. And if you see there is a biggest support which healthcare industry has received is only from the two great players, that is the pharma and the insurance agencies, pharma or the biosciences and insurance agencies. Medical device organization, not to forget them, because they have been downplaying a lot of support for the entire healthcare also, and they have been, if you see the names, you will find a lot of healthcare medical devices organizations, they are supporting this conference also. Independent service vendors, because they are the players who develop kind of ecosystems. They can be form of search engines, social media, healthcare portals, healthcare portal, hosted website providers, and a patient and citizen. Now the question comes, if nobody is paying, is the patient or a citizen has to pay? Now, I have not written purposely a consumer, because here we are not talking about the consumer. We are not a consumer. Healthcare is not something, a commodity which we are going to consume. Healthcare is a citizen's right, which has to be provided by the government, the top agency. So why all these players should interplay and not the last, the patient should pay for it? There is a need. See, if we are getting a service, which is a right of every citizen, there has to be a service integration, and in the service integration, all these players, they will downplay. So they will all constitute the role model. They will all constitute the stakeholders in the business case or a business model, which has to be there. There has to be the experience integration, experience optimization, and orchestration of the interactions. So these are the best jargon which I am downplaying, but basically down to say that whatever we have with each pocket of them, they should be collaborative, shareable, and easily available in the form of information and knowledge with everybody. And the channel management, because the patient goes to the hospital and goes to the pharmacy to get the medicine. So there is a whole lot of channel management is there. So these are basically these needs will provide a bottom line to all these business players to downplay. The factors influencing, I think a lot has been done. Change in the patient, citizens, and the physician's behavior. That is the most important in this. Increased active engagement and control of the personal health. That is most important. What will prompt everybody to use the e-health or m-health? Awareness, access, online community, and the social networks. Rest is something which has not been discussed over here. These are the various maturing tools. I would not go into the nitty-gritties, but this is taken from a white paper. We have wikis, mobile devices, blogs, podcasts which are there in the YouTube, personal health records, social network, online forums. Now, if we see how the other countries they have done it, we have known that there has been examples from other countries like US. But down the line, we need to create our own adoption and our own adaptation. I would like to use our own adaptation. It's not something which we should say that US has been a glorifying example or Europe has been glorifying example, but there has been the stages like a salt where they have reached to the stage of rethinking again. In the US also, see, when they went in evolution of the mobile health, they have started using as an independent product, independent application suites, then integrated, then made it a pervasive experience. But all these applications which were independent, integrated, or pervasive, they have their own area to surround them with the key issues to address this. Now, to bring you on to some lucid anecdotes which probably my other friends have given. Now, this is some website which gives 101 things to do with the mobile, and believe me, this is only on the SMSs, and you can read through. These can be the very potential areas if information is communicated in this kind of course. What can you see? One of the innovative thing which one of the magazines, you cough on the mobile and the mobile will tell you what kind of problem you are having. And these are the things like you put a drop of a blood on the mobile, and these are the devices which have been developed as developed, and they have been patented, applied for patents, and so much more, where all these things probably a few of my friends, they were showing yesterday and today to me that these applications are necessary. But what is the basic question which I go and rethink with myself, and I put it to all my friends, that we are talking about these applications, but how much strata of our population, Indian population, will be able to utilize these applications? Please think about it. Today, a mobile phone, which is a 10-digit device, 9-digit device, or I think 12-digit device, it is a problem reading with a person who is not a tech savvy, who cannot see because he is old, or probably who has not been literate so much. How can he even read the SMS for these applications? There have been some innovations. See, what I am trying to tell you, there has been some innovations which have been going on for over the years. You can go and search on the web that there is called a speaking web from the IBM research. They have been doing a lot of extensive research, and some of the incubations which is happening in my labs also, which is happening in IIT Chennai. Now, those are the examples where the person need not to be illiterate. He will get a IVR kind of response arrangements, where instead the SMS will be read to him, and he will speak for that SMS, and it will get translated into a text, and it goes beyond. Yeah. Okay. So with this, I just have one slide. Now this is a very good lucid slide. Show how many applications on there. Maximum applications, believe me, they on medical applications, they are on iPhones. Now this has been, I have not been the user of iPhone that much, but if you see the number of applications which have been there, and that kind of traffic which is getting generated, and it is all coming from the healthcare arena. There was an organization which came to us for a due diligence of a business case. Somehow we could not get them a funding in India, but they went to Africa. We, having done the due diligence, they were able to prove themselves, and it became the hottest healthcare SMS-based application in Pan Africa, and it is the blockbuster in the entire Africa. So that is something which is the power of these applications, and iPhone is where these applications are dominating. I would like to end my presentation with a thought. Can we afford to ignore mHealth or eHealth? Now, to sum it up, see, some of the untouched areas in the mobile health, e-health, whatever way electronic we are going, but one area which, because I have been associated very passionately with this, I started originally with medicine and then shifted to engineering. Sympathy comes before anypathy. So that is something area which you have also already spoken about. The trust and the sympathy, I think these devices, they cannot replace. Thank you.